I welcome everyone for today's webinar, which is Patient Safety, Just Culture, Culture of Safety, and the TJC and CMS Hospital CoP Standard on Safety. I would like to now introduce our presenter for today, Sheridan Calvin. So now I would like to hand over the floor back to our speaker for today. Over to you, Ms. Calvin.
Well, thank you for that kind introduction. And today I'm going to talk about one of my very favorite topics in the whole world, and that's all about patient safety. So we'll also give you some great resources that are out there. And also we're going to talk about just culture, and we're going to talk about the Joint Commission and CMS requirements regarding patient safety. And actually there's a there's a section in patient safety for CMS for hospitals. It's actually tagged 286. And there are over 700 deficiencies in the last 7 years. And so it is the highest number of deficiencies in the QAPI section. And you do see there's a lot of slides today. I just was thinking this morning about a website that was recently mentioned by CMS in the conditions of participation that is also a great resource. So if you go out to the patient safety movement, there's some really, really good things. I particularly like the one about, somebody has a pulse ox on and the alarm has to go directly to an individual. If they don't answer within 60 days, then it goes to somebody else in case that nurse is tied up or at lunch or their battery went dead in their phone or whatever. So patient safety movement. So on slide number 3, these are headlines about patient safety in hospitals. How to survive your hospital stay. Hospitals aren't safe havens, has hazards including surgical errors, infections, and falls can happen. So one of the things we're going to talk about, so the evidence-based literature that has come out, gosh, it's been out since the mid-90s now, talks about if somebody makes an honest mistake, we need to have a non-punitive environment or a blameless culture. But in quest of that, how do you balance this with the concept of accountability? So holding individuals accountable for their mistakes is even more complex than ever. So we're going to talk about how do these 4 behavioral concepts differ. So human error, so if a nurse makes a medication error. What about negligence? What about reckless conduct? Does it make a difference? Obviously, if a nurse made a mistake with human error, if somebody didn't recognize that they had high-risk behavior. And one time I was at a hospital and they had just implemented barcoding. And the nurses in the PACU, what they did was they created 2 bracelets, and they left one bracelet over by the machine so that they could, use that because at the time they didn't have portable scanners and they didn't recognize that is at-risk behavior. Reckless conduct, where, somebody doesn't like their neighbor, they intentionally do harm, or they're impaired, they've been out drinking all night, the nurse, and is an impaired practitioner and makes a mistake. Is that then reckless conduct? What about knowledge and purpose? And we'll talk about that. So I always like to start out by talking about the faces we should remember. So until about 6 or 7 years ago, I used to work 2 or 3 shifts a week at the local emergency department, and the last hospital I actually worked at for 20 years. And in my wallet, I had some pictures, and these are the people I had pictures of. And so one day I was leaving work, and somebody said, oh, are those your children or relatives? And I said, actually, no, I have never actually met any of them, and actually they're all dead. And my colleague is looking at me like going, what's going on? And I said, something, I worked all day today at my other job, and I rushed from there. I came in here. I worked from 7 p.m. to 11:30 p.m. I got to go home because I got to get up and go to my other job in the morning. And this is why these are the faces of patient safety. So I look at them and I always before I leave and I'm like, you know something, do I need to go back and check that IV one more time or check how they were doing with that pain medicine or, check to make sure this got done or whatever. So these are the faces that we should remember, putting real people who have been injured into the light so that we remember. So this was a 7-year-old little boy who had been scheduled for ear surgery that they had done thousands of times before. And the surgeon injected around the ear with lidocaine, and the child went into, he was going to use lidocaine with a little bit of epi for the vasoconstrictive effect. The child went into cardiac arrest and died, and this was at Martin Memorial Hospital in Florida. And they commenced on a big assessment of what happened, trying to find why did this little boy die. And what they found is that instead of using lidocaine with a little bit of epi, the nurse had used concentrated epi, had poured it into an unmarked sterile container, which then the surgeon drew up. Betsy Lehman, in fact, she was a healthcare reporter for the Boston Globe. It was her last day at Dana-Farber Hospital. She had just undergone a horrendous course of chemotherapy for breast cancer. An hour later, she is dead. And by the way, when they autopsied her, they didn't find any breast cancer. And the way the doctor wrote the order was, how he wrote the chemo order. What happened over 4 days, instead of dividing that into 25% each day, they thought it meant 6.5 grams every day, and she ended up getting 26 grams, so had gotten an overdose. And I've heard Josie King speak many times, and I always bring a box of Kleenex. But this little girl in the picture there is Josie King. This is her mom, Sorrel King. And so what happened is Sorrel King had said to the nurse, there's something wrong with my daughter. She's not acting right. She's sucking violently on a washcloth. She's not acting right. And the charge nurse looked at her and said, oh, you have such and such a nurse. She's our best nurse on the unit. Didn't investigate anything. An hour later, she has died from dehydration and as a result of a medication error. Susan Sheridan's story, if you haven't heard her speak, I've heard her speak multiple times too. She's a very effective speaker too. She kind of was dealt a double whammy. So her son, Cal, was born, and when he was discharged, he was jaundiced. And they didn't provide any instructions or anything. And as a result of kernicterus, he suffered permanent brain damage and permanent disability. And if that's not bad, a bilirubin test was never done, and she started an organization, got the Joint Commission involved, and changed the way that we deal with infants and checking that. And then her husband, Pat, had an x-ray, and they didn't tell him there was a lesion for 6 months. And he died of cancer as the result. And of course, we've all heard about the IOM study, the Institute of Medicine, now the National Academy of Medicine, Sciences, and Engineering. This was probably one of the most read stories, articles in America. It even made billboards. It was called To Err is Human, How Do We Build a Safer Healthcare System? And found out that adverse events occur anywhere from 2.9 to 3.7% of all hospitalizations, and that anywhere between 44 and 98,000 patients die every year as a result of medical error.
Thank you, ma'am. So with this, we conclude the session for today. Thank you so much for joining the webinar, everyone. Thank you so much and have a great day.